Hi, I'm Andy Nevada, urologist at UT Health East Texas Urology. Here are 5 things you need to know about HoLEP. HoLEP procedure is a procedure for folks who have failed medical therapies, who are having a lot of trouble with urination. It's particularly helpful in folks with very large prostates who may otherwise have to have incisions into their abdomen to treat the prostate. And we're actually able to use a laser to treat these very large prostates without any incisions through a scope. So HoLEP is different from other prostate procedures in the way that it's done. The difference essentially is that we are using a laser, and we think of the prostate like an orange. We use the laser to cut down right onto the peel of the orange, and we take all the obstructing meat out of the prostate, and that leaves a nice funnel-shaped drain for you to urinate through. And allows us to move a lot of tissue in a short period of time and to be very successful with particularly large prostates and avoid the need for any incisions and prolonged healing after that. So the benefits of this particular procedure are, again, our ability to treat very large prostates, and really any size prostate can be treated in this fashion, but to treat large prostates effectively and safely, it decreases the catheter time after a procedure, usually 1 day as opposed to a week or so. It decreases the hospitalization after a procedure, usually to a night, rather than a couple of nights. I think the one thing we always talk about after prostate surgery, and particularly the risk of prostate surgery, is that there's always a possibility, your bladder is still going to be squeezing the same way as it was before. Typically, if people have some issues with urination thereafter, typically it's with urgency, frequency, and maybe even some incontinence, okay? That's very rarely a permanent issue. If it's going to be a problem at all, it's usually a problem for a few weeks to a few months, and then it gets better with time as the bladder gets used to the new situation. So after the surgery, typically we'll watch you in the hospital overnight. We take the catheter out the next day, let you urinate, and let you go home without a catheter the vast majority of the time. Typically we see a little blood in the urine for a week or so thereafter. Typically it clears after that, and people are really back to their normal selves in about 2 weeks.